Hi, I'm Dr. Parker. I'm the director at McKinley. We're getting a lot of emails and questions that are coming from students that have come back to campus about COVID-19, so I wanted to spend a few minutes and just answer those questions. The first is, what are the symptoms of COVID-19? Think of this as a flu-like illness. It comes on very suddenly. You have upper respiratory symptoms followed very quickly with cough. Sometimes even the cough comes before the nasal discharge or the nasal drainage. The cough worsens very quickly. You have fever. What is fever? A temperature of 100.4 or greater. You feel feverish. You may even have chills. You have body aches, maybe a little headache. Those are how you think about these symptoms. So the next question is, what do I do if I have these symptoms? Well, first of all, right now, all of us are under a shelter-in-place order. So presumably, whether you have symptoms or don't have symptoms, you are obeying the shelter-in-place law. Initially, what you want to do is just see how it evolves over the next 24 to 48 hours. You don't even need to call anybody initially. Take some Tylenol and see how that makes you feel. Hopefully it makes you feel better. Drink plenty of fluids and keep yourself well hydrated. Most people, particularly in your age bracket, completely recover from this on your own. You'll get worse initially, and then you'll start getting better. And over the course of about 7 days, you return pretty much back to normal. Maybe your fever may last a little longer than 7 days, but often you have fever for a lot less time as well. So how is COVID spread? The prevailing opinion of the scientists is that it is through droplet spread. That means that you have to cough on someone, you have to get the virus onto someone else's mucous membranes, their mouth, their eyes, other mucous membranes where the virus can penetrate the skin and start to replicate itself in a new host. The other way, though, is through the spread on hard surfaces. Viruses typically only last about 2 hours on a hard surface, and if they can't find a host, they die. This virus is a little different, and it appears to stay put on hard surfaces for a much longer period of time, maybe even several days. We just don't know how long this virus will last. This is a very significant vector of spread and something that you need to be careful about with your own surroundings in terms of keeping your surroundings clean and your surroundings yours. Frequent hand washing is going to be really, really important in this. And I can speak specifically to the hand washing. You really want to wash your hands in soap and water for about 20 seconds. You want to do that frequently. If you do have the benefit of hand sanitizer, you'll want to use your hand sanitizer before you basically touch your hands on your own mucous membranes. How is McKinley operating now that we are in this pandemic? We have eliminated your ability to self-schedule yourself into McKinley. We made those decisions for your safety and for the safety of the staff. Now you have 3 ways of interacting with your provider. You can interact with your provider by phone and actually have a phone visit. You can interact with your provider via telehealth. Or you can interact with your provider through a face-to-face visit. If we do think that you have COVID and need to be tested, our respiratory unit will simply do the testing outside or in one of our rooms in the respiratory clinic. We have to work constantly with the health department over whether you're meeting the current criteria that the health department have in place for you to actually have a COVID-19 test. This is not under our control. The number of tests that are available and the turnaround time around these tests are being entirely controlled under the regulations of the Illinois Department of Public Health. And these, like last week, these criteria change during the week. And so we have to keep up with those changes and we have to follow those changes as they come about. So how are we handling prescriptions during this time? You have the ability to go into your My McKinley portal and you can request prescription refills that way. One of our pharmacists will actually bring the prescription out to you or have it available for you as you walk into McKinley so that you don't even have to go as far as the pharmacy. If you are out of town, say you're off campus, we can manage that as well and mail you your prescription, which will take a couple of days for you to obtain it. If it's something that you need acutely, we can call it into a pharmacy nearby, but under that scenario, it'll be paid for under your private insurance plan. A lot of people are asking whether there's a vaccine. There are actually several vaccines that are in development. The availability of a vaccine may be a year away. There are many researchers looking for existing medication types that can either stop the spread of this virus or mitigate the symptoms of this virus. We'll learn more about that together.